بسم الله الرحمن الرحيم. Today we will have case quiz number 123. Case data: 30 years old male complaining of 24-hour history of a painful and swollen left knee with no history of trauma and no previous history of joint problems. Over the last 2 days, he had noticed redness and soreness in both eyes. The patient was married, non-smoker, but returned from a business trip to Africa. On examination, the patient temperature was feverish 38.5 degrees centigrade. Eyes are red. Brown macular rash on the sole of both feet. Left knee was hot, swollen, and tender to palpate, with no other joint detection. Investigations: hemoglobin within normal, white BCs somewhat elevated 14, and the upper maximum of normal is 11. Platelet within normal. ESR shooting 75 for the first hour. Sodium and potassium were within normal. Urea and creatinine within normal. Blood culture showed no growth. Urine analysis showed no blood glucose or proteins. Knee X-ray showed soft tissue swelling around the left knee. So, what is the diagnosis? As I said in the previous video, the case is straightforward. There is no unexpected thing in this case. The case is simply reactive arthritis. Yes, reactive arthritis. Sometimes we bring to you difficult and challenging cases, but from time to time we need to revise our basics. So this case is reactive arthritis. Reactive arthritis is classically a clinical triad of urethritis, conjunctivitis, and seronegative arthritis, mainly affecting the large weight-bearing joints, usually knees and ankles. However, not all the three symptoms are always seen in the same patient at the same time. It can be triggered by either a dysenteric infection or sexually transmitted infection. The characteristic rash seen is keratoderma keratoderma bilineuragica. A brown macular rash usually seen in the palm and the soles. Non-steroidal anti-inflammatory drugs are the mainstay of therapy, and antibiotic given at the time of non-gonococcal venereal infection will reduce the likelihood of that person developing reactive arthritis. And finally, thank you very much for your attendance, and we will meet you tomorrow with case quiz number 124. Wassalamu alaikum wa rahmatullahi wa barakatuh.